we're going to look at chapter 2 today, and this is really all about putting the patient and the public first. And there's a key phrase in there which is nothing about me without me. And a lot of the services that they want to develop are about developing online service, and much more emphasis is going to be on creating greater use of patient-reported outcomes, and they're called PROMs, and collecting patient experience data and through surveys, etc., and enabling patients to rate services and clinical departments according to the quality of care. And also to require hospitals to be open about their mistakes that they make. The feedback from patients and carers and staff will inform other people who have similar conditions to make the right choice of hospital, so where's the right place for them to go. Information will improve accountability so the public can see where there are unacceptable services that are being provided, and they will be able to exert local pressure for them to be improved. And there'll be much more about showing nationally comparable data and information, and that'll all be published. So there'll be much more emphasis on transparency. And it's about also how commissioners how well they will be performing as well. The aim will be to make comparisons about safety, effectiveness, mortality rates, infections, and adverse events and avoidable deaths. The patient experience will be monitored as well, so waiting times, cancelled appointments. Patients will be able to see the GP that they want, and they'll be able to see their records, and they'll be able to pass these records on to people that they want them to be passed on to, and so that support groups can actually help the patients. The information sort of generally will be collated by Health and Social Care Information Centre, and that will be able to help patients to make choices. So the information they collect will be there to help the patient. And it will help them with the choice of provider so that they can have a choice of any willing provider that they want. A choice of a named consultant-led team for elective care, and it will be able to extend maternity choice and to begin to introduce choice of diagnostic testing and choice of post-diagnostics. And choice of controlling long-term conditions and personalised care planning and end-of-life planning to support having a good death. And also to give much more information on research studies that have been carried out. Every patient should have a right to choose to register with any GP they want, and even if they move house, to keep the GP that they've developed a relationship. To develop a coherent 24-hour urgent care service in every area of England, which will include GP out-of-hours services, and will help by using new technology in order to give the patient and clinicians a way to communicate that isn't just face-to-face. And the money will follow the patient. Now, the patient will have a significant voice, and that will be articulated through HealthWatch, which will be created as an independent consumer champion within the Health Quality Commission, and we'll talk about that as well a bit later. But the role of HealthWatch will ensure that the views and feedback from patients and carers are an integral part of local commissioning. Local authorities will be able to commission HealthWatch or HealthWatch England to provide advocacy and support, helping people to make a complaint or feeding that information in, so that local authorities, they can use that information to help them put lever pressure so that they can make the local health institutions have much better care. And it will help the Health Quality Commission investigate poor services. So the questions that we've got today is, what do you think about giving more control to the patient and them having, so that they can make informed decisions? Do you think there should be this level of transparency? And what do you think of setting up HealthWatch and HealthWatch England? So they're just a couple of questions. And if you've got any comments about what you've heard in this chapter, I think it would be good if you could just comment on it as well. Thank you.